Before we start with the next plenary session, which is on future of health insurance distribution networks, we have a presentation on the FICCI-EY joint report on value-added services. The presentation will be given by Mr. Irvinder Singh Lail, Director, Financial Services Advisory, ENY. I request Mr. Lail to kindly come on the stage for the presentation.
Good afternoon, everyone. It gives me immense pleasure to be at this event, FICCI, and to be representing EY work on value-added services, which is specifically catered to the health insurance industry. So, after lunch session, I think let's play a game. I think, how many people are insured here with the health insurance? 90%. And how many people out of this 90% population feel that their insurer are investing in their health? Look at the facts, guys, in the room. So actually, healthy people of the disease capital of the country, and actually, we're doing the conference in the most polluted city in the world, by the way. And these healthy people who are really educated and literate, they invest in their health. They pay their premium and time. And what do they feel? Actually, if you look deep inside you, you would feel that you are at loss. Because insurers are busy paying claims to one who are actually not keeping their health up to the mark. I'm not saying that insurers should not pay claims, but I'm saying what's in it for people who are investing in their health and who are actually working on their body day in, day out. And I think that's where we actually move to wellness. And that's where we actually see why wellness is important. So if you look at facts, 43% of India mortality is actually contributed by the diseases which are more prone because of our lifestyle. And as a country, we are moving from mortality to morbidity. As a country, we are adopting a lifestyle which is not good for us. As a country, we are moving towards more prone to heart attacks, more prone to diabetes, more prone to cancer. And at the same time, we have a hectic lifestyle. At the same time, we have stress to our job. At the same time, we are moving into a rapid industry which is going on 3x, 5x when it comes to hospitalization cost. So let's look at one-on-one. So actually, why wellness is that important, and and what are the factors which basically will improve this important part of keeping yourself healthy? I think what we need here is an ecosystem which will actually help you live a healthy life. And that ecosystem is basically nothing but it's an amalgamation of different individuals, which includes the customer, which we all are, which includes the insurance provider, which includes the provider, which gives wellness facilities, the primary care health unit, and also includes the indirect partners, which are digital startups, which have more control on analytics, which have more control on how the customer behavior can be looked at basis what he's doing today, basis his activities. So there is a deep need of understanding each stakeholder and their role in this ecosystem, so that when we keep the customer at the center and create this ecosystem, the customer ends up living a healthier and longer and a happier life. I think that's what it's all about. So if we move on and look at the current style by which the health insurance is actually going, and you have the regulator opening the doors for investing into wellness and health. How can we take this as an advantage to create one system which helps the customer, which helps the provider, which helps the insurers, and it becomes a win-win equation in this country. And it actually helps all of us because we all are customers. We all are day in, day out investing into our health. We all know how hospitalization costs are rising day by day, and how we invest in our own wellness proactively can help us stay away from the big claims and big insurance premiums, and how insurance companies can manage their claims much better, manage their customer engagement much better, and end up having a profit book which is lower on claim, high on retention. Now, if we move on to what is the role of insurer, and insurer actually has a very core role in this because it's one of the most critical touch points to all these parties, including the customer, including the provider, including the digital companies or the primary care unit. So I think my understanding of this entire criteria is that one who has to invest in it has to think out of the box. And once you start thinking out of the box, you would really understand that the investing, proactively investing in the health, proactive investing in the packages which includes wellness, primary care, can help you give longer run over the period of time. And this can only be done if you have a long-term goal and if you understand that your risk assessments and your analytics can help you draw this as a story over the period of 3 to 5 years. So what insurer can actually do? Today insurers are doing annual health checkups. Okay? I can again do a word, but facts are only the health checkup utilization is not more than 30 to 40%. So is that really helping? I think there is a need to intervene here, and there is a need to provide a more innovative product which can really, which can move on. I think there is a very high driver of cost which is running this country. The hospitalization costs are going 3x and 4x. So the cost drivers are there. There's a huge amount of awareness on health. Healthcare industry itself is evolving every day. Every day we see maximum procedures are going into daycare. So what should we do? I think there's a need wherein we look at we as an insurer should look at innovative products which can be more into assessment of health risk. How can that help? That can help you create more disease care programs for your clients. It can help you understand the behavior of your own customer and how his behavior is changing over the period of time. How should you intensify, how should we invest in it, and why should you invest in it? So when you actually look at this, you will understand that there are some key challenges in which we need to understand some key questions which may be attached to insurers, which may be attached to network, which may be attached to cost. So actually the key questions, if I would put it, is what kind of wellness we require? Do we really need a primary care layer in our entire healthcare industry? Do we really need a wellness provider who takes care of the insured end to end, starting from his jogging exercise, starting from his eating habits, starting from his wearable devices, what he is wearing today, okay? And who would bear this cost? That's the important question to answer. Can this be marginally divided between the customer, between the insurers, between the providers? And there are countries in the world who are doing and running this model successfully. So why shouldn't we look at that? And how would we drive the adoption? And what are the answer to adopting this further? Why would I as a customer should pay for this and adopt this? So is that we have to refurbish our loyalty programs? Do we have to bring in the reward program again? Do we have to look at giving them rewards back for being healthy? It's like earn and burn, and that can help. So ultimately, there are really big questions to be answered here. I think with my session, with attending this session today morning and going through the new health regulation, I think IRDAI, the regulator, made their point very clear, and they are open towards these ideas. And what important is with us is if we go back and innovate this and come back with an idea which actually brings in this disruptive thought process of insurers reinvesting back in insured and creating value over the period of time. I think that's is the thought which I want to leave this room with. I would encourage the team, the people here, to go through our report and come back to us in case of any questions. In the last, I would like to thank the task force team, Ashish and Priya, for their insightful thoughts and inputs, and also FICCI and IRDA for helping us on this opportunity. Thank you so much.